If you've ever sat on the toilet sweating, straining, and waiting 45 minutes for relief that never comes, one moment you feel a little constipated, a little bloated, maybe you think it'll pass, but then, suddenly, nothing moves. You sit there pushing harder and harder, yet the stool feels trapped, stuck deep inside the rectum like your body has completely locked up. The pressure builds, your stomach tightens, you start sweating, feeling weak, shaky, exhausted. Some older adults become so strained that they feel dizzy, nauseated, even short of breath sitting on the toilet. And here is the part many people never realize. When stool becomes stuck in the rectum, it does not just affect the bathroom. It can quietly affect your entire body. Your appetite disappears, your belly swells, your energy crashes, your balance feels weaker. Some people even become confused, dehydrated, or too uncomfortable to sleep properly. Because when waste cannot leave the body, it is like a traffic jam at the very end of a tunnel. Everything behind it begins slowing down too. And after 60, this can happen far more easily than most people realize. Dehydration, medications, less movement, weak abdominal muscles, ignoring the urge to go just this once. These small hidden changes quietly build over time, until one day your body reaches a breaking point. But here's the good news. In this video, I'm going to walk you through 5 immediate emergency-style steps that may help bring relief safely and calmly at home, before things become more dangerous. And one of these steps, the one many seniors skip out of embarrassment or fear, may be the very thing that finally helps the body release naturally again. We are also going to talk about the red warning signs that mean you should stop waiting and get medical help immediately. Because sometimes what looks like simple constipation can quickly become something much more serious. But stay with me until the end, because I'm also going to share the gentle recovery habits and 4 simple prevention routines many older adults never learn. The small daily habits that may help stop this painful situation from happening again in the future. And for many seniors, that part becomes life-changing. Because this is not just about constipation. This is about protecting your comfort, your confidence, your dignity, and your independence as you age. So take a slow breath. You are not alone in this. And by the end of this video, you will understand what may be happening inside your body, what to do right now, and how to help your body feel safer, calmer, and more in control again. Now, the first step may sound simple, but it is extremely important. Stop straining. When the body feels blocked, the instinct is often to push harder. Many people think more force will solve the problem faster, but excessive straining can actually make things worse. Pushing too hard may irritate the rectum, worsen swelling, trigger hemorrhoids, or cause small tears in delicate tissue. In some cases, it can tighten the blockage even more, making stool harder to pass. For older adults especially, intense straining can also place sudden pressure on the heart and blood vessels, sometimes causing dizziness, weakness, or lightheadedness. Instead of forcing the body, the goal is to help the muscles relax naturally. Positioning can make a meaningful difference. Try lying or sitting on your left side with your knees slightly bent toward your chest. This posture follows the natural shape of the bowel and may reduce pressure in the rectal area. For many seniors, this simple adjustment helps ease the sensation of being trapped or stuck. Next, focus on slowing your breathing. Take a gentle breath in through your nose, then exhale slowly through your mouth. Anxiety and panic automatically tighten the pelvic floor muscles, which can make bowel movements even more difficult. Relaxed breathing helps calm that response and may allow the body to work more effectively. You are not overreacting for feeling uncomfortable or anxious about this situation. That reaction is completely understandable. A warm heating pad or warm towel placed across the lower abdomen for 10 to 15 minutes may also help relax tight muscles and reduce cramping. And remember this carefully, calming the body is not delaying progress. In many cases, It is the first real step toward helping the body release naturally and safely again. But if the stool has already become very dry and hardened, relaxation alone may not be enough, and that leads to the next important step. Now, here is something many older adults do not realize until constipation becomes severe. Dehydration is often a major part of the problem. As the body ages, total water content naturally declines. Many seniors also drink less during the day because they fear nighttime urination, bladder urgency, or frequent bathroom trips. On top of that, certain medications, including some blood pressure drugs, antihistamines, and diuretics, can quietly increase fluid loss without obvious warning signs. Over time, stool loses moisture and becomes harder, drier, and far more difficult to move through the bowel. That is why hydration becomes so important during a blockage. Start slowly with warm fluids rather than drinking large amounts at once. Warm water, herbal tea, or clear broth are usually gentle options. If tolerated well, try sipping 2 to 3 glasses gradually over the next hour. Warm liquids may help soften hardened stool while also stimulating natural movement in the digestive tract. In many people, the bowel responds better to steady hydration combined with warmth than to forceful straining. And this next point matters. Try to avoid very cold drinks right now. Extremely cold liquids can sometimes cause temporary tightening of bowel muscles, which may worsen discomfort. Excess caffeine is also not ideal because it can contribute to dehydration in some older adults, especially if fluid intake is already low. Now, this may sound like a small adjustment, but even modest improvements in hydration can sometimes create meaningful changes inside the bowel. Softer stool moves more easily, places less pressure on the rectum, and is often far less painful to pass. And remember, dehydration affects much more than constipation alone. It can worsen dizziness, weakness, fatigue, confusion, and balance problems, issues that can seriously affect independence and daily life after 60. But if hydration and relaxation still are not enough to restore movement, the next step is often where many seniors finally begin experiencing real relief. Now, this next step is something many people feel uncomfortable discussing, but it is important to remember, this is a medical issue, not something shameful. For many older adults dealing with hard stool trapped low in the rectum, gentle glycerin suppositories can become an effective turning point toward relief. Here is why they may help. When stool sits in the rectum too long, it often becomes dry, compacted, and difficult to pass naturally. Glycerin suppositories work by drawing moisture into the stool while also lubricating and mildly stimulating the rectum to encourage a bowel movement. In many cases, this combination helps soften hardened stool enough for the body to begin moving it more comfortably. For seniors, glycerin suppositories are generally considered one of the gentler over-the-counter options when used properly. Before using one, apply a small amount of petroleum jelly or water-based lubricant around the suppository and the rectal area to reduce irritation. Then lie on your left side with your knees slightly bent, which follows the natural curve of the lower bowel and often makes insertion easier and more comfortable. After inserting the suppository gently, remain lying quietly for about 20 to 30 minutes if possible. And this next part matters. Do not rush or strain during the process. The bowel often responds better to relaxation, moisture, and gentle stimulation than to force. Anxiety and excessive pushing can tighten pelvic muscles and make passing stool more difficult. Once you feel ready, try walking slowly around the room for several minutes. Light movement may help stimulate bowel activity naturally and encourage the rectum to empty more effectively. Some people repeat a suppository several hours later if needed, but older adults should speak with a pharmacist or healthcare professional first, especially if they have heart conditions, bowel disorders, or take multiple medications. And remember this clearly. Needing support does not mean your body is failing. But if stool still does not move after these measures, stronger lower bowel relief methods may become necessary. And that is the next important step to understand. Before we move into the next step, I want to pause for a moment and say something important. So many older adults suffer through constipation, bowel blockages, or painful bathroom struggles completely in silence. They feel embarrassed. They feel uncomfortable talking about it. Some even begin blaming themselves or feeling like their body is breaking down. But this happens to far more people than you realize. And sometimes the emotional stress becomes just as exhausting as the physical discomfort. So if you are still watching right now, and this message is helping you feel a little less afraid or a little more informed, I want you to type the word hope in the comments below. Just one word, hope, because your body is not beyond help, and because staying informed is one of the most powerful ways to protect your comfort, your dignity, and your independence as you age. You may also help another older adult reading these comments realize they are not alone in this struggle. Now, the next step is where we begin talking about a stronger option many people use when suppositories still are not enough. And this is where gentle technique becomes very important. Now, if suppositories still are not providing enough relief, the next step many healthcare professionals consider is a gentle enema to help soften and loosen stool trapped lower in the bowel. And the most important word here is gentle. Many older adults become frustrated or anxious at this stage and assume they need the strongest treatment possible. But overly harsh enemas or aggressive laxative methods can sometimes irritate the bowel lining, worsen cramping, increase dehydration, or place unnecessary stress on an already sensitive digestive system. That is why milder approaches are usually preferred first. A warm saline enema, such as a fleet saline enema, may help soften hardened stool and stimulate movement in the lower rectum. Some people also use warm water with a small amount of salt, but the fluid should always feel comfortably warm, never hot, to avoid irritation or injury. The goal is not to force the bowel into emptying. The goal is to gently reintroduce moisture, relaxation, and movement so the body can respond more naturally. Lie on your left side during the process, since this position follows the natural curve of the colon and may help the fluid distribute more comfortably. After administering the enema, try to hold the liquid for several minutes if possible, usually around 5 to 15 minutes depending on comfort and tolerance. While waiting, gently massage the lower abdomen in slow, clockwise circles. This simple technique may help stimulate bowel motion, reduce pressure, and encourage the rectum to begin releasing stool more effectively. And please remember this: your digestive system deserves the same attention and care as any other part of your health. There is no shame in needing help when your body is struggling. In fact, many seniors find that calm, patient care often works better than panic or force. But now we need to discuss something even more important: the warning signs that mean home treatment may no longer be safe, because waiting too long in those situations can become dangerous. Now, this may be the most important message in this entire discussion. Sometimes home remedies are not enough, and knowing when to seek medical help can protect both your health and your safety. If you have tried hydration, relaxation, suppositories, or enemas and still have no meaningful relief within 6 to 12 hours, or if the pain, pressure, or bloating continues getting worse, it is time to contact a healthcare professional or seek urgent medical care. And certain warning signs should never be ignored. Severe abdominal pain, vomiting, fever, heavy bloating, confusion, blood in the stool, dizziness, or an inability to pass gas may signal that the blockage is becoming more serious and affecting the digestive system more broadly. In older adults especially, these complications can escalate faster than many people realize. There is also one symptom that often confuses people. Sometimes liquid stool or watery diarrhea begins leaking around a hard impaction. Many assume this means the constipation is finally resolving, but the solid blockage may still remain trapped underneath. That is why worsening symptoms should always be taken seriously, even if some fluid suddenly begins passing. When pressure builds inside the bowel for too long, the entire body can begin struggling. Dehydration, Inflammation, weakness, appetite loss, balance problems, fatigue, and mental confusion may all worsen rapidly in seniors. But please remember this clearly. Seeking medical care is not failure. It is responsible, informed action. Doctors and nurses treat stool impaction and severe constipation far more often than most people realize. In some cases, medical teams may safely perform manual disimpaction or provide stronger treatments that help the bowel recover before dangerous complications develop. And early treatment is usually much safer, simpler, and less painful than waiting until the condition becomes severe. Protecting your independence does not mean suffering silently. It means recognizing when your body needs additional support and responding before a manageable problem turns into a medical emergency. And once relief finally happens, the next important step is helping the body recover, while reducing the chances of this frightening situation happening again. Now, even after the blockage passes, your body may still feel sore, irritated, tired, or emotionally drained for a day or two. That is completely understandable. Your bowel has been under stress, so this is the time to focus on gentle recovery, not force. Warm sitz baths can be very soothing. Sitting in shallow warm water for 10 to 15 minutes 2 or 3 times a day may help relax the rectal muscles and ease lingering discomfort. For the next couple of days, choose soft, high-moisture foods that are easier on the digestive system. Oatmeal, bananas, cooked vegetables, applesauce, soups, and warm broths are often gentler choices. And keep hydrating. Aim for around 6 to 8 glasses of water throughout the day unless your doctor has fluid restrictions. Also, try to begin gentle movement again. Even a slow 10-minute walk can help wake up the bowel naturally. Because recovery is not just about relief. It is about helping your body feel safe, calm, and strong again. Now here is the encouraging part. Small daily habits can make a very big difference in preventing this from happening again. Habit number 1 is hydration. Sip water steadily throughout the day instead of waiting until you feel extremely thirsty. Aging bodies often lose the thirst signal earlier than we realize. Habit number 2 is movement. Even gentle walking or light chair exercises help stimulate the bowel. Your digestive system works a little like muscles. Movement helps keep everything flowing. Habit number 3 is fiber, but slowly and carefully. Soluble fiber from oats, psyllium, fruits, and cooked vegetables can help soften stool naturally over time. And habit number 4 may be the most overlooked of all. Create a bowel routine. Try sitting on the toilet every morning after breakfast and use a small footstool to improve posture. These tiny routines may seem simple, but protecting bowel health is also protecting comfort, confidence, mobility, and independence later in life. Before we finish, let's quickly review the warning signs you should never ignore. Seek medical help immediately if you develop severe abdominal pain, vomiting, nausea, fever, confusion, blood in the stool, heavy bloating, or an inability to pass gas. And remember this surprising sign too. Sudden watery diarrhea can sometimes mean liquid is leaking around a dangerous blockage, not that the problem is solved. Your body sends warning signals for a reason. Do not try to push through serious symptoms alone. Getting help early is often safer, easier, and far less frightening than waiting until your body becomes exhausted, dehydrated, or overwhelmed. Before you go, I would really love to hear from you. Which part of today's video surprised you the most? Was it the danger of straining, the dehydration connection, or the warning signs many people mistake for normal constipation? And if you feel comfortable, share whether you or someone you love has ever struggled silently with this issue. Your comment may help another person feel less embarrassed, less frightened, and less alone. Because digestive health is not something to hide from. It is part of protecting your comfort, your dignity, and your independence as you age. And sometimes honest conversations are where healing begins. If this video helped you feel calmer, more informed, or more hopeful today, please take a moment to like the video and subscribe to the channel. And most importantly, share this with someone you love. A parent, a spouse, a friend, someone quietly struggling with discomfort, constipation, or the fear that aging means losing control of their body. Sometimes, one simple piece of guidance can prevent pain, panic, or even a hospital visit. Here, we believe growing older should not mean growing helpless. It should mean growing wiser, stronger, and more prepared to protect your health, your dignity, and your independence, one small step at a time.